What's up, nurslings? Dr. Squeech here. I wanted to share with you a mnemonic that I came up with in, I think, 2013, specifically for pharmacology. So if you have studied before, there are different mnemonics for the nursing process, but those don't really work well for organizing information specifically about medications. So this is canals, and we're just going to go letter by letter, and then we're going to do an example. So when you're looking at pharmacology, you have to figure out what's the most important information without writing every single thing down. So first, you got to know the classification. Is it an ACE inhibitor? Is it a beta blocker? Then it's the action of the medication. Now you have to be specific, because if you just say lowers blood pressure, that doesn't really help you understand how it actually works. So if we're looking at, say, digoxin. Digoxin is a cardiac glycoside. We'll do an example here in a little bit, but how does that actually work? What does it do to the cells and organs and tissues of the body to cause the effect that we're after? Nutrition. Is there anything that your patient should or should not have when taking this medication? Odds are you're probably going to have a question on NCLEX. What are you going to remove from your patient's tray because they're on said medication? The next one is administration and antidote. The administration talks about, is there anything we need to know or do before we give that medication? Is there a lab we need to check? Is there a vital sign we need to check? The antidote, I tell my students all the time, if a drug has an antidote, you need to know it. Because if you walk into the room with the incorrect antidote, you're not doing your patient any good. Labs, what are the most important labs you need to know for this medication? And then side effects. Now, side effects can be a tricky one because nausea, vomiting, diarrhea, and all the common ones are common. So we don't want to write everything about everything. You want to write the characteristic stuff. What's unique about that medication? Okay, so now we're going to move through the canals using a specific medication. The one I've chosen is digoxin, brand name Lenoxin. Knowing both of them together really does help you familiarize yourself so that when you see one and the other together, it doesn't matter which one you get. So the first one, again, classification. Digoxin is classified as a cardiac glycoside. Another form of classification, another name for the classification is called an inotropic. And that leads us into the action. What this does is digoxin is going to lower the heart rate, and it's going to increase the force of contraction. What that means is it's going to slow down the heart rate so that it can fill more completely, and then the increased force of contraction makes it so that the muscle squeezes a little bit harder and gets blood out more effectively all the way from the nose to the toes. Nutrition, we tell people, avoid alcohol, but there's not really a whole lot of things that we pick on with digoxin. The administration guidelines, you do have to check an apical pulse, and you should hold the medication if the pulse is less than 60, okay? There is also an antidote. So the antidote for this is DigiFab, also known as DigiBind. This is going to bind to the extra medication in the system and help the organs flush it out of the body. Labs, there is a serum lab. So anything meant to have a maintenance is going to usually have a maintenance serum lab to go with it. The lab for digoxin is 0.8 to 2 nanograms per deciliter. This is going to tell us if the patient has too much, too little, or just the right amount of the medication in their system. And the side effects. Now, digoxin does have some GI upset noted. So even though I said nausea, vomiting, diarrhea, there's enough complaints of patients having GI upset. It is noteworthy. Another thing that's unique is they have halos in their vision. And what that means is they're going to have little rings, usually yellow or green in color, around objects in their field of vision. That's unique. That's characteristic. So if you look at this and look at what you usually write down in terms of how much information you're trying to remember, this is typically a lot briefer. It's typically a lot more condensed, and that's really going to help you kind of pick out the most important stuff, because you can't know everything about everything, and it does you no good to spend hours and hours writing down tons of information only to never want to look at it again. Another thing I recommend is when you have disease processes and medications, write them out in the same color. So if I were studying heart failure, I would write out my notes on heart failure in blue, and then I would write out all the information on digoxin in blue. So that when I take my test, if I can't remember, if I get stuck, all I got to remember, oh, it was blue, and all my heart failure stuff and all my digoxin was in blue. So I hope that helps you. If you have any questions, please leave a comment, a suggestion. I'd love to help you out. Thanks, guys. Have a great day.